Hello, I'm Megan Clark. Welcome to the webinar, A Practical Guide to Clinical Handover in Aged Care Facilities. Viewers are encouraged to watch the webinar along with the practical guide. This webinar has been made possible through funding provided by the Australian Government under the Primary Health Network program. The purpose of this webinar is to support and assist clinicians in residential aged care facilities to provide effective clinical handover consistent with relevant standards and to improve communication skills, in particular when communicating with general practitioners. So what's in this webinar? We will overview the standards, look at what clinical handover is, why it's important, roles and responsibilities, the principles, how to use ISBAR, review some scenarios, and look at some resources and tools that can be used by you. In this webinar, the terms patient and resident are used interchangeably, and so are the terms clinical handover and handover. Two relevant standards that healthcare organisations may need to meet are the National Safety and Quality Health Service Standards, Standard 6, Clinical Handover, and the Aged Care Quality Standards. The information in this webinar is consistent with the requirements outlined in relevant standards. However, they do not address, nor do they intend to address, all the standard requirements. Individual organisations and facilities should still refer to the full standard when looking to align their policies, processes, and quality improvement initiative with best practice. The intention of the national standard is to ensure that a timely, relevant and structured clinical handover occurs that is appropriate to the clinical setting and context that supports safe patient care. A full copy of the clinical handover standard is contained in the National Safety and Quality Health Service Standards and is available on the Commission's website. The Aged Care Quality Standard focuses on appropriate documentation and communication processes to ensure that safe and effective personal and clinical care is provided. For further information, please go to the Department of Health Ageing and Aged Care website. Facts and figures. Some facts that support the need for good clinical handover processes include: handover provides a very important part of that exchange of information, critical and vital to the continuity of care of your patient. Clinical handover using face-to-face communication provides more opportunity to clarify information. Clinical handover is high-risk scenarios for patient safety. Dangers include discontinuity of care, adverse events, and legal claims of malpractice. What is clinical handover? Clinical handover is the transfer of professional responsibility and accountability for some or all of aspects of care for a patient to another person or professional group. It involves the transfer of patient information between individuals or groups and is an important part of clinical care. Let's consider an example of a poor clinical handover. Tom is a registered nurse, and at the end of his shift, he gives the following handover to the evening staff. Mrs. Song rang her call bell this morning and said she was feeling unwell. Her husband visited yesterday and he had mentioned she was unwell and had a headache. I gave her 2 Panadol, FFU, which meant for Tom feeling unwell. I think you should call her GP, Dr. Brown, and tell him that Mrs. Song is unwell. At completion of his shift, Tom does not think the matter is important enough to document that Mrs. Song had been feeling unwell. Now let's reflect on this scenario. What are the problems with this scenario? Was the handover effective in transferring responsibility and accountability? The issue in this scenario are Tom being vague and unclear with his communication, making up acronyms which were confusing, making no assessment of Mrs. Song, nor had he collated any information, and the event also was not documented. Unfortunately, as a result of the lack of assessment, lack of documentation and lack of clear handover, the incoming nurse did not monitor Mrs. Song closely, and because what she saw as other priorities to attend to did not ring her GP, Dr. Brown. The next day, Mrs. Song deteriorated quite rapidly, suffered a stroke, and was admitted to hospital. Why is clinical handover important? An effective handover improves the experience and involvement of the resident and their family and carers, improves resident safety, improves action and coordination of the resident's care, reduces the chance for residents or family members to repeat their story, enables effective use of resources, and enables effective transfer of professional responsibility and accountability for care. What is your role and responsibility during the transfer of care? All staff have a responsibility to ensure effective communication and transfer of information with relevant members of the team, with residents and their significant others, and with relevant external parties at every transition of care with consent. You need to know the organisation's policies, processes, tools and forms. Engage the resident, seeking their consent or that of their caregiver for transition of information and inviting their participation and communication in what is happening. Know with whom and when to communicate. Know what minimum information is required to be communicated. Use structured and effective communication skills and ensure transfer of responsibility and accountability for care. Principles of clinical handover enable a flexible, structured approach. Handover can occur in different ways, and the most appropriate way will depend on the circumstances. For example, on the telephone with a clinician at another site, such as a resident's GP, or for an emergency. Between two nurses or other health professionals, the resident and significant other, such as when there is a shift handover. During a scheduled case conference meeting involving the resident, their family, carers and health professionals. Transferring resident to paramedics that have arrived at the facility. Before and at the end of shifts, which is often verbal and should be documented in the resident's notes. In the event information is to be sent by email, it is suggested to follow RACF standards and use a secure messaging system. In all scenarios, the 4 key principles of clinical handover should be adhered to. Step 1, hand. Allocate staff roles to reduce disruption and maintain safe resident care and ensure all participants are aware of the venue and time of handover. Prior to handover, clinicians should collate information and obtain relevant documents. Step 2, me. Make sure all participants have arrived before starting the handover and that the handover will be supervised by a designated leader who will assume responsibility. Step 3, N. Handover should ensure that staff are notified about and potentially alerted about residents who may require significant levels of care or attention, those who may be deteriorating, any relevant occupational safety issues that may affect on safety, and potential patient movements. All staff should be aware of the clinical and environmental context in which they will be working. And step 4, ISBAR. Handover of a resident should be achieved through a standardised process that includes the transfer of accountability and responsibility to another team member. ISBAR is a simple and flexible, structured approach for handover. Please be aware there are variations of ISBAR in clinical safety literature, including ISBAR, shared, and SBAR. Each facility may have their own policy and procedure that staff should be familiar with and follow. There are resources and tools you can use to assist you. This is an example of a form to assist practicing a standardised handover. ISBAR is a simple structured framework to use during clinical handover. It is widely used around Australia. The steps are: I's for identification. Identify yourself as to the other clinician, outline the reason for the handover, and provide 3 resident approved identifiers. S is for situation. Provide an overview about what's been happening with the resident during the relevant shift. B is for background. Provide relevant history and information. This may include date of admission, presenting symptoms, medications, recent vital signs, test results, and changes in health status. A is for assessment. Complete an assessment that considers vital signs and investigations undertaken, what needs to be done for the resident. R is for recommendation. Provide what needs to be done to be clear about what you are requesting and the timeframes. Let's consider a good clinical handover scenario. Maggie is a registered nurse. She's looking after Mrs. Downton today. After breakfast, Mrs. Downton becomes irritated and aggressive and subsequently had a fall. As a result of the fall, she has a skin tear on her left arm and is complaining of pain in her right hip. Maggie has decided to contact Mrs. Downton's GP, Dr. Lee. In preparation for the handover to Mrs. Downton's GP, Maggie completed the 3 resident identifiers, including name, date of birth, and facility wing room number, and an ISBAR form. Maggie rang Mrs. Downton's GP shortly before lunch. Firstly, Maggie identified herself and gave the reason for the call. Hello, Dr. Lee. I'm Maggie Cox, a registered nurse from Sun Aged Care. I'm calling about your patient, Mrs. Joan Downton. Date of birth, 9th of the 4th, in Moon Wing, room 3. I'm aware you may be busy. Is now a convenient time to talk? Maggie then provided Dr. Lee with an overview of the situation. Mrs. Downton, 86 years, has been irritable and aggressive and fell over this morning. She has a skin tear on her left arm. The skin tear has been cleaned and dressed and does not require stitches. She is complaining of pain in her right hip and has been administered 2 Panadol tablets, 100 milligrams of paracetamol. Maggie then provided GP Dr. Lee with some additional background information. As you may recall, Mrs. Downton's husband passed away earlier this year and she has commenced a new antidepressant medication. Maggie then provides Dr. Lee with an overview on Mrs. Downton's condition. Mrs. Downton's observations are stable, BP 140/85, but her pulse rate is higher than usual, 120 beats per minute compared to 100. Her behaviour has settled and her skin tear has stopped bleeding. She is able to mobilise slowly, but I am concerned as she continues to complain of right hip pain. She states that the paracetamol has not eased the pain. Maggie then asks, before I call an ambulance, would you like to review Mrs. Downton? Dr. Lee advises Maggie that an ambulance should be called as soon as possible. Maggie called the ambulance. She then updates Mrs. Downton's clinical notes, speaks to Mrs. Downton about what she has recommended, and obtains her agreement to be transferred to hospital. She then contacts Mrs. Downton's next of kin, prepares documentation for the paramedics, and awaits the ambulance arrival. You might like to pause the webinar for a moment and reflect on what did Maggie do well in her handover? What could have been improved? And was the handover effective in transferring responsibility and accountability? The key messages from this webinar are: clinical handovers serve different functions and are more than just a transfer of information. Effective structured handover enables action to be taken to provide appropriate and safe resident care. Think carefully about which attendees should be present at handover. Be prepared, be clear, be focused and organised. Ensure the resident, their family or significant others are involved, consulted and participate as appropriate. Consider factors that affect clinical handover, such as change of shift times, Having a quiet space for communication, avoiding interruptions such as phone and resident staff queries, and the amount of time available. Provide relevant and accurate information and data in a timely manner, being careful to avoid acronyms and jargon that may confuse others. Ensure the residents' files and records are up to date following the handover. There are a lot of clinical handover resources available. Several useful resources are the Aussie Guide to Clinical Handover Improvement is one key resource that has been developed to support the implementation of the National Standard No. 6. Implementation Toolkit for Clinical Handover Improvement, government websites, and the practical guide that aligns with this webinar. Thank you for attending this webinar and hope this will assist you to provide effective clinical handover.